Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to teach you how to get ready for an exam of your female private parts. When you visit the doctor, you will usually have some sort of exam. Exams help find problems early, they help prevent future problems, and they can help figure out the cause of a concern that you might be having. A pap smear is an exam inside the vagina that most women have once they are adults to check for cancer of the cervix. For women, private parts are the parts you usually cover with a bathing suit. They are breasts, vulva, vagina, and rectum. I'm going to show you now a few models of women's private body parts. Here is just a small model that shows you where inside the body you have a bladder that holds your pee, a uterus is the place where a baby would grow or where your period blood comes from, and then your ovaries, where you make an egg each month that then can flow down these tubes. Now let's look at how these parts fit inside your body. This is your hip bones, and this is the bottom of your body. The uterus and ovaries fit right in this area. We call this the pelvis. You can see on your bottom that there are 3 different openings. The first one is the urethra, or where your pee comes out. You could call it a pee hole. This is the opening to the vagina, which is the tube that connects to the uterus. And this is the opening to your rectum or your anus. It's where your poop comes out. You could call it a poop hole too. In the community, you always keep your private parts covered. It may feel odd or even bad for another person to see your private parts. You have learned about good and bad touch. Let's talk about necessary touch. Good touch, like a hug, might make you feel happy, safe, or comfortable. Bad touch, like a punch, might make you feel hurt or forced or afraid. Necessary touch can describe touch that might not feel comfortable, but you still agree to do for your good health. Necessary touch can help your doctor decide if that part of your body is healthy right now. Doctors and nurses are trained to examine bodies. They protect your privacy. They touch you only to do exams and tests that are necessary for your health. This is a different rule than in community. Many women find that it helps to talk with a trusted person about having a female exam. It can help you make the decision to agree to the exam. Ask your doctor for advice too. If having this exam is hard for you, tell your nurse or doctor. Tell them if you feel worried or scared. If you decide to agree, we call this consent. Once you say yes, you may also want to talk to someone you trust about getting ready for the exam too. You can use this video to help you get ready. Some patients may want to pick which doctor does the exam. If it's not an emergency, you can ask to schedule your visit with someone specific. Some women prefer to have a woman doctor. For the exam, you will need to get undressed from the waist down. On that day, many women like to take a shower or a bath. Some women like to bring someone else with them for support. Now we're going to talk about what happens during the exam. You will lay on an exam table with a sheet across your legs, and you will put your feet in holders that are called stirrups. I'm going to now show you some of the equipment the doctor uses and how the doctor uses it. The doctor will use a speculum to look inside your vagina. Let's look at a few different specula. This is one that's plastic. Here's one that's metal. And here's one that even has a light attached to it to make it easier for the doctor to see inside. There may be a larger lamp in the room to also help the doctor see. Once the doctor puts the speculum inside a person's body, they then are going to use some other devices that we call brushes, spatulas, and swabs. Here's an example of brushes. This is a spatula. that just rubs inside the vagina and the cervix. And this is a swab. It would be okay to ask your doctor to show you these tools. If you are worried, you might want to see these at a visit before you have your exam. Seeing or touching the tools might help you feel more comfortable. It's very important to relax your muscles to help make the exam easier. You can learn to relax your muscles before your visit. Here's how to practice. Lay on your back and touch the bottom of your feet together. Let your knees open out and fall down toward the bed as far as you can. Keep your bottom on the bed. Think about making the muscles of your legs loose and relaxed. Practice taking big, deep breaths in and out. This is a lot like the position you will be in for the exam. The next step is to see what happens during the exam. Check out the next video, What to Expect, the Female Exam, on our website forourhealth.org.